Hello everyone, Dr. Houghton here, your friendly neighborhood gastro doc. Today, let's discuss IBS. IBS stands for Irritable Bowel Syndrome. This should not be confused with IBD, which stands for Inflammatory Bowel Disease, and is a whole other condition. If you had to choose between the two conditions, you would pick IBS. As bothersome as it may be, it's still not as serious as inflammatory bowel disease. IBS is a common condition and one of the most common reasons that someone comes to a GI doctor's office. IBS symptoms include abdominal cramping, pain, or bloating, along with either constipation, diarrhea, or alternating back and forth between these two symptoms. Officially speaking, IBS does not need to be a diagnosis of exclusion, meaning we don't have to rule out other possible causes of these types of symptoms first. In real life, however, I like to rule out some treatable conditions first, namely celiac disease, Helicobacter pylori, and gallbladder problems. SIBO, or small intestinal bacterial overgrowth, as well as lactose intolerance, are also good things to exclude as well, especially with bloating and diarrhea as someone's predominant symptoms. Many patients don't know this, but there is an official way to diagnose IBS, and it's called the Rome criteria. Why did they name it the Rome criteria? Well, in the case of IBS, a group of international experts got together in Rome, Italy back in 1988 and came up with the first set of criteria to make the diagnosis of IBS. Since that time, 4 additional iterations of the Rome criteria have been developed, and we are currently on Rome 4, with Rome 5 criteria set to be released next year. I bet you all can't wait for the new set of Rome criteria to come out. Here's what the criteria look like. You can actually look these criteria up for yourself. And there are actually a bunch of what we call other functional gastro disorders. Some of you that have long-standing symptoms and have not gotten an answer from your doctor will likely fit into one of these categories. Otherwise, there's no concrete test or finding that can tell us if you have IBS. In other words, say I perform an upper endoscopy and a colonoscopy on you, I can't come out from the procedures and tell you that you have IBS. I can, however, rule out other conditions, but I can't actually diagnose IBS with scopes. The last thing I wanted to mention is that IBS, although super annoying and bothersome at times, will never lead to anything bad, such as Crohn's disease, ulcerative colitis, cancer, or bowel blockage. I'll discuss the treatment of IBS in another upcoming video. Until then, be well.